Okay, I'm going to get us started. As colleagues appear, I'll call them out. So for the record, my name is Ricardo Arroyo, Boston City Councilor for District 5. I'm the chair of the Boston City Council Committee on Public Health. I'm joined by my colleague, Ed Flynn, today. Councilor Ed Flynn. The public hearing is being recorded and live streamed at boston.gov City Council TV. It will be rebroadcast on Xfinity Channel 8, RCN Channel 82, and Verizon Files Channel 964. We will take public testimony at the end of the hearing. If you wish to testify via video conference, please email Shane Pack at boston.gov to sign up. When you are called, please state your name and affiliation and residence, and limit your comments to no more than 2 minutes to ensure that all comments can be heard. You may also submit written testimony by emailing the ccc.health@boston.gov. Today's hearing is on docket number 735, a message in order for the confirmation of the reappointment of Rebecca Gutman as a member of the Boston Public Health Commission's Board of Health for a term expiring January 15th, 2023. Docket 736, a message in order for the confirmation of the reappointment of Manny Lopes as a member of the Boston Public Health Commission Board of Health for a term expiring on January 15th, 2023. A message in order for the confirmation of the appointment of Guale Valdez as a member of the Boston Public Health Commission's Board of Health for a term expiring on January 15th, 2022. Manny Lopes and Guale Valdez are both here today. Rebecca Gutman was unable to attend, but did submit a letter and is a reappointment. So we have her resume and her letter, and I'll make sure that all the counselors have that. And so as we begin, I'd like to note, thank you, Councilor Flynn, for being here and present. I'm going to allow Councilor Flynn, if you're okay with that, Manny Lopes, just to state what the Boston Public Health Commission Board of Health does for folks that are listening. What are the seats that are being filled? And then I'm going to go to opening statements from you, Councilor Flynn, you, Manny Lopes, and you as well, Mr. Valdez. Does that work for everybody?
It does. Thank
you. All
you.
right, perfect. Thank you. So Manny, if you could just give folks that are watching this sort of overview about what the Boston Public Health Commission's Board of Health does.
Sure. First, thank you, Chairman Arroyo and Councilor Flynn, and it's a pleasure to be with you this afternoon. The Boston Public Health Commission serves as Boston's Board of Health. So we oversee policies related to the health of the city, servicing under Mayor Walsh. We provide amendments as well as oversee, from a board perspective, we oversee the strategy and the overall operations of the Boston Public Health Commission. The commission members are made up of community leaders from the community who have an interest in serving as leaders within the commission to help us build our strategy and, of course, give the resources needed for the staff at the Boston Public Health Commission, the resources they need to execute on that strategy.
Thank you. That's perfect. Very well done. Very brief. It's just, what are the seats that are being filled here today? Obviously, you're a reappointment, Mr. Lopes. Ms. Gutman is a reappointment. And am I pronouncing that correctly? Is it Gutman or Gutman?
It's Gutman.
Okay. And then Mr. Valdez, I believe, is the only new appointment. And so just what are those specific seats that are being filled?
That's correct. So Mrs. Gutman has served on the commission now for a couple of years. So it's her reappointment. She currently is a member or serves as a leader within SEIU, which is a healthcare union located here in Boston, in Massachusetts, servicing many of the members who work in healthcare. Mr. Valdez is a leader at Mattapan Community Health Center, and I won't take his introduction away from him. I'll let him do that, but he's been a leader in healthcare for a long time in the Boston area, and we're excited about his appointment to the commission, and he'll be serving in one of the seats that were vacated by a former community health center leader. So that's a seat dedicated to community health centers. That was part of the statute that created the Boston Public Health Commission.
Thank you. That's very helpful. And now I think we can go directly into just openings for folks that are here, I want to note that Councilor Mejia is joining us. And just for those watching, basically, there's two reappointments happening. Rebecca Gutman, who's not here but has sent a letter, Mr. Lopes, and just correct me if I'm wrong on this, and this might be part of your opening, but Mr. Lopes, you're the chair, I believe, of the Boston Public Health Commission?
That's correct, Chairperson. Yes.
Thank you. And then the addition of Mr. Valdez, who I know because Mattapan is in my district, and he's done an excellent job running the community health center in Mattapan. And so I'm now going to give our two counselors a chance to speak on this, but this is a hearing to hear from two reappointments, one who's not present for other reasons, and then a new appointment, Mr. Valdez, to the Boston Public Health Commission board. And so with that, Councilor Flynn, if you have anything to say, now's the time. And then obviously I'll let people have questions after Mr. Valdez and Mr. Lopes have spoken.
Yeah, thank you. Thank you, Mr. Chair. And I had an opportunity to review the resumes and the letter from Ms. Gutman and from Mr. Valdez and for Mr. Lopes as well. But I'm very familiar with Mr. Valdez and Mr. Lopes, their long-time commitment to public health in our city, especially helping communities of color, low-income residents, our immigrant neighbors. So I know we have two outstanding leaders in the city, and as well as Ms. Gutman as well. So I'm proud to support all three of them and looking forward to the Q&A. But I just want to say thank you to all three of them for working so hard in support of so many people in need of a voice on public health. And Boston's lucky and fortunate to have leaders like you. So I just want to acknowledge you and your professional work that you're doing across our city and helping so many people. Thank you, Mr. Chair.
I'm muted, like this isn't my 80th Zoom meeting. Thank you, Councilor Flynn. Councilor Mejia, if you have an opening statement.
No, just thank you so much for hosting this. I'm here to listen and learn. Mattapan Community Health Center is near and dear to my heart. I don't live too far from there. And I know Sharon, who is, I'm blanking on her last name, so I feel incredibly embarrassed. I just dropped the name and I can't even remember her last name, but I know Sharon, that's how I know her as. She has been part of a community health center since a good friend of mine, Carla Walker, worked there many, many, many years ago. And we did a lot of work around teen health prevention education. And so really excited to see you and be here. And Manny Lopes, I started off my career in public health in '93 when HIV and AIDS and violence was at the all-time height. And before the commission was established, worked with Bradley Cohn, who heads up your HIV and AIDS public health division. So at least I'm dropping some names that I remember back in that day. So really happy to be here and to participate in the conversation. Thank you.
Thank you, Councilor Mejia. And I just want to say, I don't expect none of these appointments are controversial. You're likely to get unanimous votes of support. And so the reason for this hearing really was to give anybody who might have a question for either of you the opportunity to ask that question. But also, I think from a forward-facing standpoint, it's important, especially in the times that we're in now, for the community to know what the Boston Public Health Commission is and what they do and what the board specifically does. And I believe both of you are, and you can speak to this, the community health center representatives on the board, but just the makeup of what this board looks like, what the board does, your interest in joining this board or continuing to be a part of this board as it is for you, Mr. Lopes. And I think we could probably then do a quick round of questions if there are any, and if not, release you because I know you're both incredibly busy. And so with that, Mr. Lopes, followed by Mr. Valdez, if you would like to make your statements or anything else you would like to say. Thank you.
Okay, great. Again, thank you, Chairperson Arroyo and the members of the committee. I want to start by giving you a little bit more of a background about me and then go into what we've accomplished really as a commission, particularly over the last couple of years, and then of course most recently with the pandemic. So as many of you know, I've devoted my career to increasing healthcare access for vulnerable and underserved patient populations and improving health outcomes for our communities that are disproportionately burdened by negative and social determinants of health. As you already know, I currently serve as president and CEO of East Boston Neighborhood Health Center. And with 1,300 employees and nearly 120,000 patients, East Boston Neighborhood Health Center is one of the largest community health centers in the country. Quality and low cost and no cost care is what drives our mission. And very similar to Mattapan Community Health Center, we strive to make sure that everyone can come in and get care regardless of their ability to pay, language that they speak, or insurance or employment status. Throughout my service on the Board of Health, I've had the opportunity to provide strategic leadership and guidance to the Boston Public Health Commission staff, and I've worked in partnership with city staff to put forth several budgets that have made key investments and innovations to protect and preserve the health of Boston's most vulnerable populations. As you know, the Board of Health has also regulatory responsibilities under our enabling statute, and I'm proud of the policy work that we've done as a board to protect youth and communities of color from lifelong nicotine addiction through amendments we adopted in 2015 to raise the tobacco and nicotine purchasing age to 21. In 2019, we restricted the sale of flavored nicotine delivery products, including menthol cigarettes. And I'm proud to say both of these amendments were ultimately adopted at the state level. I'm confident that these protections will prevent nicotine initiation among Boston's youth, encourage existing smokers to quit, and advance Mayor Walsh's Imagine Boston 2030 goal of reducing disparities in premature mortality between Boston's neighborhood. I'm also proud to work with Mayor Walsh's to implement Mayor Walsh's executive order declaring racism a public health crisis. This declaration challenges us to build on years of work to address health inequities while sharpening our focus on understanding and addressing the role that racism plays in driving adverse health outcomes for our residents of color. So before I close, I just want to say how much I value the work that I do today at the Commission. I value the work of Mayor Walsh and Chief Marty Martinez and many of the talented and dedicated staff at the Health Commission, as well as agencies across city government, including the City Council, which have really ensured that we have robust and coordinated response to this horrible pandemic, and especially in hard-hit communities like East Boston, Mattapan, Roxbury, and Dorchester, which are primarily communities of color. And I know that these efforts and this partnership are saving lives, and we will help lay the foundation for a just and equitable recovery. And thank you, and I welcome any questions you may have.
Thank you, Mr. Lopes. Mr. Valdez.
Good afternoon, Chairperson Arroyo and Councilor Flynn and Councilor Mejia. Thank you for your kind words. My name is Guale Valdez, and I'm a resident of the South End, and I work in Manhattan. I'm honored that Mayor Walsh has appointed me to serve on the Board of Health, Boston Board of Health, and I just want to share a little bit about my background. I joined Mattapan Community Health Center in 2010 as the Chief Financial Officer. When I started, it was with the purpose of coming up with financing for a new building. We were working out of a building that didn't identify us, but it had its challenges. And in that role, we were able to come up with the financing, and we have been in our current location for 8 years. I've been the CEO now for 3 years. I'm accountable for all aspects of the health center, and I report directly to the Board of Directors. And I have been asked what my vision is, for the health center, what my vision is for Mattapan. And I've responded to that with a very simple, with a very powerful message. And that is, and I do this at every orientation for every new employee that we have, and also to our existing employees. I'm never going to ask you what our mission statement is. What I would ask you to do is to remember 2 words from that mission statement. And the key words are improve and exceptional. And if you remember those two words, then it defines who we are. That is a true understanding of our mission statement, not just simply reciting words. Every question, every problem that's brought to me, the question I'm going to ask is, how does this improve the well-being of our patients? And how are we going to do this in an exceptional way? Those are the questions I've asked. And we've made great strides in the last 3 years with the progress that we've made and how we deliver care. I have a very, very diverse background. I have an undergraduate in accounting. I have an MBA with concentration in healthcare administration, and I've worked for a broad range of organizations. And what this experience has given me, it has given me a sense of idealism, but also the practicality that comes with that. And the best example I can give you that is where we're currently located. When I started at Mattapan, there were offers that were made that Mattapan should just build a 2-story, really simple building. That we were coming out of a building that had its deficiencies, was working out of a double-wide construction trailer, and a 2-story new building would be good for Mattapan. And they were right. But we had a vision and we had a dream that the residents of Mattapan deserved the best. That the residents of Mattapan deserved to come into a structure that everyone could be proud of. The city supported that dream. The state supported that dream. Federal government supported that dream through some very generous grants, and our donors supported that dream. It was a sense of idealism with the practicality of how we funded this endeavor. And that's what my experience has given me, is I get to be idealistic, and we get to do this in a very practical way, because at the end of the day, we need to keep our doors open. Now, I also believe that Mattapan deserves a voice. Mattapan needs to be heard wherever possible. And as a result of that, I'm a member of several boards. I'm on the board of the Massachusetts League of Community Health Centers, Boston Accountable Care Organization. And what this has allowed us to do is to speak for the residents of Mattapan, to speak for our patients. And as a nation and as a city, we face a crisis of racism and a public health emergency, which are confounded by the social determinants of health. And nowhere is that reality more true and more present than in the community that I serve every single day, which is Mattapan. What I'd like to point out is, for example, 34% of our patients are served in the language, best served in the language other than English. Every health center in the city, every hospital in the city faces this challenge of language barrier. So when I speak for our patients in Mattapan, where English is not their first language, it's for every patient in the city of Boston. And my hope is that in addition to sharing the perspective of a CEO at a community health center, I can do this on a broader level. I tell our staff, I ask our staff to make a difference every day. Make a difference in one patient's life. And if you do that every day, those differences start adding to each other. So I appreciate the opportunity to make a difference. I am humbled by this opportunity, and I believe that we need to be constantly searching for opportunities to deal with racism, to deal with our public health challenges, and to take care of our patients. Thank you again. And I welcome any questions you may have.
Thank you so much. And we've been joined by Councilor Savi George. And just to sum up sort of what you may have missed, I believe we've had an opening really about what the Boston Public Health Commission does. Rebecca Gutman's not here. She's a reappointment, but she did send a letter and we have her resume. Mr. Lopes is here. He's the chair of the Boston Public Health Commission board. He's a reappointment, and the only new appointment is Mr. Valdez, who's the head over at the Mattapan Community Health Center. And I'm just gonna give you sort of my questions for both of you, and then go down the line by order of arrival. And this should be pretty quick. One thing I'll say, because it was brought up, Mr. Lopes, is the racism is a public health crisis was something I took on when I first actually came in March. And the reason I was able to do that was because the Boston Public Health Commission had already done a lot of this labor. They'd already done all of the data analysis. They've already made many of these conclusions. So it wasn't so much that I had to do like some deep investigation to figure out racism as a public health crisis was a viable and the right thing to do. I was able to do it because the Boston Public Health Commission had already set the groundwork for that, had already set the foundation for that, and was already trying to do work in that field. And I wanted to make sure I gave voice to what they were doing. And so I see the Boston Public Health Commission as one of Boston's treasures, really, and something that is really helpful to the work that we do. And so I'm glad to hear you speak to that. And I'll just say one of the things that I'm happy about with who's here today is the representation that we're seeing present here. And so just as a question for the public, for the counselors, how many folks, Mr. Lopes, are on the Boston Public Health Commission board?
There are 6 members of the board.
And do you know what the racial and gender breakdown of that is?
Yeah, we pay close attention to that, so we're intentional in making sure that the commission represents the city. So we have myself, and I identify as Black, Cape Verdean. My parents originated from Cape Verde, and I identify myself as Black. We have Philly LaBaptiste. She identifies herself as, I believe, Black as well. And we have, the commission was created as part of the merger with Boston City Hospital and University Hospital, not to go down a history path, but that meant we had a permanency for the CEO of Boston Medical Center, which was, again, the creation of Boston City Hospital, the city hospital, and a private entity, University Hospital, which was owned and run by BU Medical Center. So the CEO of Boston Medical Center has a permanency, an ex officio seat on the commission, and that's held today by Kate Walsh, and, a woman, white woman. And then we have Commissioner Gutman, that we already mentioned in her reappointment. I believe she identifies as white woman. And then we have John Fernandez, who's the president and CEO of Mass Eye and Ear. And my apologies, I'm not sure how he identifies himself. So
No, of course.
misrepresent that. And then trying to remember one more. Myself, and we hope that Mr. Valdez will be joining us, and I'll let him identify, state how he represents himself. And then I'm forgetting one more commissioner, a woman who I believe represents, who's also white.
And so I put you on the spot a little bit with trying to go down the line. So
No, okay.
So for me, I think the work of East Boston Health Center, just, you may not know this, my father receives his care there. And so, obviously, I don't know if there's a better compliment to be paid there, but that's an indication, I think, of the quality of the care and the trust that we place in East Boston Health Center and under your leadership. And so, I'm very familiar with you, sir. And so there's not many questions there. And similarly for you, Mr. Valdez, I know we're really proud of the Mattapan Health Center. And I think if I have any question, the one question that I would have for you is, you spoke a little bit about your vision for Mattapan. And I guess my question, once you're on the Boston Public Health Commission, it has Boston in the name, and it might not be too different of a vision, but what is your vision moving forward for health in the city of Boston? How do you hope to have this role, to use this role to advocate for? What are the things that are sort of your top priorities?
One of the top priorities, and so many other things fall under this, are access. It is about promoting access, and it's access for everyone. Access regardless of age, access regardless, there are transportation issues, for example. Access regardless of the ability to pay. One of the things that we've done, and we do this through, for example, innovation. We were very fortunate to receive a very large grant through the FCC. We decided to go on our own. There's some risk involved in that, but we're paid to take very calculated risk. We have 6,000 Bluetooth devices. We're going to place those devices in Mattapan because I feel the residents of Mattapan deserve the same access that our more affluent neighbors have. And we're looking to share best practices with the rest of the city, the entire city. every person who right now is challenged with coming into the health center. And after we get past this pandemic, and I am an optimist, also a realist, we will get through this pandemic. We're not going to go back to the way things were with 100% office visits. How much easier would it be for an individual that we can monitor daily with the use of technology? And that technology should be rolled out throughout the entire city. It shouldn't be reserved just for one neighborhood. But if we can monitor consistently, for example, and we can use this technology with a patient in Mattapan, why can't we do that with a patient in Roxbury? Why can't we do that with a patient throughout the city? And then there's funding available for that. And one of the things, we work very closely with Boston Public Health Commission. We're very fortunate to receive some key grants from the commission. And we're very appreciative of those. The other thing is for example, we're involved in a neighborhood trauma team. And when an incidence of trauma happens, we respond to that. We send out our own teams. We offer counseling to those that have been impacted. This cycle of violence also has to stop. And we're on the front lines of that. So is East Boston. So is every other health center in the city. But to answer your question, access and everything that is involved with that access, and access to the use of technology, and access by addressing the social determinants of health.
Thank you. That's perfect. That's good for me to know. I intend to, frankly, vote for all of you. So there's not really I don't think anybody here is like on the fence. For myself, I'm certainly not. And so the order just for folks to make a question or a statement: Councilor Flynn, Councilor Mejia, followed by Councilor Savi George. So Councilor Flynn, the floor is yours.
Thank you, Councilor Arroyo, and again, thank you to the to Mr. Valdez and Mr. Lopes that are here and for their service. The question I have, maybe to both of you, is one issue that I probably spent more time on over the last 3 years than any other issue is language access. And I know you both do tremendous work on public health issues in the immigrant community. I have 4 women in my office that are immigrants, and they speak various languages: Cantonese, Mandarin, and Spanish. I couldn't do my job without my staff because they're able to communicate with my constituents. I guess my point is, can you just generally talk about the importance of language access as it relates to public health and what we can do better or what we can improve to make sure that non-English speaking residents have the same level of services, health services as English speaking residents? And again, just want to say thank you for your work, and I look forward to supporting all 3 of you, but I would be interested in hearing your comments. And my final point is, Mr. Lopes, I know you merged with the South End Community Health Center. I think that's a tremendous, it's going to be tremendous for the neighborhood in the South End. So I want to welcome you in your team to the South End. You'll do exceptional work in the South End, just like you have done in East Boston. So I want to say thank you. And maybe both of you, if you'd like to speak on the importance of language access.
Sure. Mr. Valdez doesn't mind, I can go first.
Please do.
I think to address the needs of the city, it begins with first making sure that our staff represent the community we serve. So I'm proud to say that 50% of our staff come from the community, which means that they not only speak the language, but they know the culture. So as we know, just speaking the language is important, but it's also understanding the culture. So for us at East Boston, we have a very large, we're very blessed to have a very large interpreting services department that provides on-site or today virtual interpretations as well as translation skills. And again, these are individuals who come from the community. Second to that, I think it's important for us to be aware that it also has to be put in the right grade level. So as we know, a large portion of our population have a high school diploma or less, and making sure that it's at an appropriate language level for individuals that we're serving. So I think we need to take multiple lenses when we're looking at providing services in languages that our patients or our communities are best served in. And for us, that's 75% of our patient population prefer to receive their care in a language other than English. And I think it's an important part of our job. And I think from a public health perspective, I know the commission has done quite a bit of work to make sure that all materials are translated in the multiple languages that our city speaks. And I think they've done a great job at doing that.
I would answer this in two perspectives. The first perspective is we were asked to participate in a study. And the first question I asked was, what languages are you offering the surveys in the study? And they said English and Spanish. And said, but the majority of our patients speak Haitian Creole and feel more comfortable in Haitian Creole. But we're not going to be able to do that. We just eliminate it. And my response was, it wasn't harsh, it was very respectful, but I said, you're asking our community what they need, yet you're eliminating it. And I said, we want to participate, but you please come back to us in languages that are appropriate to our community. But we have individuals on staff that speak Haitian Creole and individuals that speak Spanish. We also use translators. And for a medical visit, that works okay. It's not the best. It's better to have that kind of face-to-face contact. But an area that we would like to see some changes or some start now, because it's going to take a couple of years for this to unfold, is we cannot find, and we have been looking for 2 years, for a therapist who speaks Haitian Creole. Language interpreter lines don't lend themselves that well to a 30 to 45 minute therapist visit. We have approached schools. We've offered internships. If we could find a student who speaks Haitian Creole, we will do everything we can to support them to get them to come to us. We should start addressing the pipeline that's generating therapists and encourage more individuals who speak languages other than English to become therapists. And we do that by supporting these programs, by having financial incentives for these programs. We can offer translation services for dental. We can offer translation services for medical. It's much, much more challenging to do it in a, like I said, a 30 to 45 minute therapy session. And that's where we have one of our biggest challenges.
No, thank you. Thank you both for your answers. I appreciate it. Councilor Roy, I have no further questions. And thank you to the panelists for being here and for your incredible work in the city.
Thank you so much, Councilor Flynn. And I'll just say, Mr. Valdez, we should touch base on the Haitian Creole therapist issue, because I think one of the things that I know is near and dear to my heart personally is ensuring that we have representation in therapy. There's a big difference in therapy when it's provided from a perspective and a lens, whether it's gender or race or immigrant construct, to a person who understands that. And so that those are all very important things. And so we should touch base off this about that. Councilor Mejia.
Yes. So the person's name is Sharon Callender.
Calendar, yes. Calendar.
She's
still with us.
She's still with you guys. Yes, and she's the Director of Community and Family Engagement.
Yes.
Which is why I remember her, because I did a lot. That's the space that I operated in. It was family and community engagement, and how important it is to have families engaged in all aspects of their lives. And I'm just curious. I know that Councilor Arroyo asked in terms of the makeup of the commission. Mr. Lopes, if you could just give me some insight in terms of young people and what, if any, opportunities exist to have youth voice and representation in that space. And when I think about representation, for me, having grown up in a life of poverty, I think that socioeconomic status and class and level of education is also just as equally as important in terms of representation. But that's not something that we normally talk about when we think about filling quotas. We always just go into the race situation. So I'm curious, as the chair of the commission, what are you thinking about in terms of ensuring that when we look at representation, we're going on beyond the racial makeup?
From a board perspective, I think it's something that we would I would love to see. What the staff has done, which I'm very appreciative of, and I can't remember the name of the group, so my apologies, but there's a youth advisory group, board, that comes and visits the commission on an annual basis. And that group really gives us insight in terms of, this next generation. What are they concerned about? What are the issues? Everything from, as you mentioned, from school to work, to safety, to lifestyles, and they really help inform the staff, and the staff have them present to us in terms of some of their findings and some of the issues that within their peer group that we should be thinking about, and how we should move this along. And in fact, during the debate on the nicotine amendments, they were a very important voice because, as you can imagine, this was a very controversial, amendment that we were taking up to ban, particularly menthol. That, at least I'll say personally, I felt very strongly about, because we know that if we know the history around flavored tobacco, particularly menthol, it was targeted to communities of color and underserved communities. And I think the voice of that, the youth and in this generation really helped just strengthen our position that this was the right thing to do. Although it did not, there are winners and losers sometimes when you make decisions like this. And we were hearing very strongly, particularly from one particular group, of the economic impact that would have within particularly convenience stores.
So the reason why I asked is because many years ago, I used to work at the Boston Prevention Center, which is now Health Resources in Action. And we did a lot of work on youth development. And we realized that young people usually have the best answers to the issues that we're contending with in terms of health disparities. And I just want to advocate that as you continue to build a board, that we find an official voice. So not just that they're serving as a committee, but that there is some official voice and space for young people to help inform decision-making on a more a formal basis. So that would just be, I know this hearing is not about me advocating for that, but since I got you in my face, I might as well just tell you that that's what I'd like to see you all consider working. So I am going to just ask Mr. Valdez a quick question in regards to community health centers in general and the role. I always often say that Boston, we are resource rich, but coordination poor. And when we think about trauma, and we think a lot about the issues that our young people and families are carrying in their little backpacks, I'm just curious, what would you say your vision is for a more of a kind of like breaking down the silos? Like I think that oftentimes the Boston Public Schools aren't really working that closely with the Boston Public Health Commission as much as they should. I know that they have the Youth Development Network and that program is directly in the schools, but I'm just curious about what you think your vision may be to incorporate more of the health centers, the Boston Public Schools, some of the nonprofits, to kind of have a coordinated strategy.
Sharing calendar. My response to that would be sharing calendar. Sharing calendar knows everyone in the community. And one of the things is I've gone through a restructuring now to get Sharon to spend more time in the community. I want our staff to be facing outward, not necessarily inward. And the work that we're doing has to go beyond our four walls. And the only way that we can do this is by promoting outreach and its coordination. Once Zoom has allowed us to do a great deal, but also once again, when this pandemic is over, we have a facility where we can bring organizations together. We had the superintendent come out for a presentation here at the health center before the pandemic. That was ideal for us because it brought in families into the health center, and that's what we want to be. We want to be a center for the community, and it's about outreach and it's about coordination, and we need individuals to do that. As far as working with our fellow health centers, one of the changes that I've seen happening is we work very closely with our fellow health centers, and it's going to take all of us coming together. And before it was, these are my patients, and you've got your patients, and my patients live in my neighborhood, and your patients live in your neighborhood. And this started even before the pandemic. If we have figured out how to do something, we want to share that. And other health centers, we have reached out. When I first started, we sent our dental team to Whittier Street, because Whittier Street figured out how to do some things the right way. That, my response to you would be that same concept applies. It goes beyond the health centers. And it involves getting the health centers together and starting a program to do outreach to Boston Public Schools. One of our board members is a teacher in the Boston Public School system. And she is a strong advocate for our presence. We have a school-based health center. A lot of us have school-based health centers.
Mhm.
But the only other thing I want to say is we can't do a lot of community testing. We can do testing for COVID here in a building. Several health centers came into Mattapan, 2 blocks away where our employees park their cars. And my response to all that was thank you. Thank you for coming in and taking care of our community, because we can't do it all. And this is one of the changes that's happened among the community health centers. These are no longer just my patients. These patients belong to all of us. And these issues belong to all of us. And no one health center can solve this. No one hospital can solve it. So.
Thank you for that. And then I just want to add to something that Councilor Flynn said, and I promise Councilor Arroyo that I'm done, is that when I think about language access, I really look at this conversation in terms of information justice. There's some of us who have more than what we need, and there's some of us who are dying to have it. And I think that we often just think about it in terms of interpretation and translation. I was the official translator for my whole family, and having to interpret at health, at doctor's appointments and things that I should not know about. I had to learn how to translate. And I think that was really tiring for me. But I just think that we also have to be mindful that there are a lot of people who don't know how to read or write, even in their own native language. And as we start thinking about information and sharing, that we just have to be super mindful of what we're pouring out and utilizing more audio and visuals to communicate with folks as we continue to move forward. So that's just a recommendation that I urge everyone to consider. And I will yield whatever rest of the time that I have. And I'm really excited to have you both and looking forward to doing a favorable yes vote for you both.
Council Mejia, do you mind if Chairman Arroyo, do you mind if I jump in and just share that I have with Council Mejia? My mom did not know how to read or write either. I taught her how to read and write at the age of 11 so she could become a U.S. citizen. And I was her interpreter as well. So I agree with you. If I was in my office, I'm at my home today, you would see a visual around masking up, washing your hands, and social distancing that really has very little words, but it has pictures. So I'm aligned with you on that. Thank you for sharing that.
That's I'm gonna make me all teary out here, but that's my mother. That's who I'm always fighting for when I think about language justice. So
I'm definitely with you on that. Same thing.
Thank you, both of you, especially Councilor Mejia, for bringing your whole self to this, but also I think this conversation shows the importance of lived experiences really in the ways in which that shapes our leadership. And so with that, Councilor Savi-George, the floor is yours.
Thank you, Mr. Chair, and thank you both for being here with us and for the work that you continue to do in your community health centers that I do know well, and just very proud of the work that you continue to contribute to our residents across the city and beyond. I actually don't have any questions. I just want to take this moment because you're both here to thank you for your continued commitment, for your partnership, especially in last year's Needle Take Back Day that we weren't able to do this year. And hopefully won't have to do going forward because our pharmacies will be taking them back for us. But just grateful for your continued commitment to our city and to the work that remains undone. Thank you, Mr. Chair.
Thank you so much, Councilor Savi-George. And that is the sum total of this hearing, I think. I really think this was beneficial. Like I told you from the outset, I don't think nothing about what you do is controversial, or you as individuals is controversial. You do great work. I think this is just a good chance for the city of Boston who is watching this and will have this for posterity to kind of know the people behind the scenes that are working on their behalf. And I think that's really important. If there's any closing statements that any councilor would like to make, I'm happy to give you the floor to do it. But otherwise, I'm happy to adjourn so that you can both get back to the work that you're doing. I noticed that you're both in your offices. And so I appreciate you taking the time to be here today. So if Councilor Flynn or Councilor Mejia would like to say any final statement, I see Councilor Flynn nodding no. Councilor Mejia, nope. So it looks like you're free to go and do your work, and then we'll be pulling this out of the docket tomorrow so that we can officially move forward with your approval and have Mr. Valdez hopefully join your ranks. So thank you so much for what you do.
Thank you.
Thank you.
This meeting is adjourned. Thank you.
Bye-bye.